Once again, a very good morning to everybody. Thank you very much for joining in. My name is Sumaya Raghavan and I have with me Anand Srivastava. And we are from Revive Heart Foundation Eye Care Holy Family Hospital, which is in Bandra West. This project by the name of Revive Heart Foundation started 4 years back. Spearheading this project is Dr. Brian Pinto, Dr. Yash Lokhandwala, and Dr. Manju Sinha. They started this project because they lost a lot of their friends, doctor colleagues. Dr. Desai was giving a speech between doctors. He collapsed, had a cardiac arrest. Dr. Rakesh Sinha, a marathon runner, and he was jogging up Pali Hill one morning where he collapsed. Unfortunately, by the time they brought him to a hospital, he was declared dead. Similarly, a lot of people in our country died due to a sudden cardiac arrest due to the lack of knowledge. People do not know that if somebody collapses in front of you, has a cardiac arrest, what you need to do till medical help arrives. So they started this project, and from then till now, we have trained more than 1,20,000 people, which includes police personnel, fire brigade people, railway personnel, college students, corporates, and even residential member societies. So we are very happy that you all have registered on our website and logged in today. So let's have a wonderful session. So the topic for today is sudden cardiac arrest. Very few of us have heard about this, but a heart attack is very commonly used. So the first thing we need to understand today is that a heart attack and a cardiac arrest are two different things. So coming to a heart attack happens when the arteries to the heart get blocked. They get blocked due to so many reasons: long time diabetes, high cholesterol, smoking habits, and because the arteries to the heart get blocked, blood doesn't flow freely to the heart. So what does the person feel? Chest pain, jaw pain, shoulder pain, excessive nausea. He sits down and says, I'm not feeling well, बहुत छाती में दर्द हो रहा है, please take me to the hospital. So you put this person in a taxi or a car and rush this person to the hospital. This is a heart attack situation. But a cardiac arrest is totally different. A heart that pumps like this, आपका भी दिल ऐसे ही धड़कता है. The heart just stops. And because the heart stops, the person just collapses wherever he is. Could be in the house, on the road, on the street, in a mall, on a railway station. Kahin pe bhi hai, if the heart stops, the person just collapses. Now, what is the function of the heart? It pumps blood to the various parts of the organ and to the brain. And if the heart stops, blood doesn't even reach the brain. And if the blood doesn't reach the brain, in 3 minutes, the brain goes into a damaged condition. Person goes into a coma, and 10 minutes he is gone. Now tell me, if somebody collapses in front of you, who's going to help this person in 3 minutes? Will you reach a hospital in 3 minutes? Will an ambulance come to you in 3 minutes? Or any doctor going to help you in 3 minutes? Chances are very slim. So who's going to help this person? You are going to help this person. But when are you going to help this person? When you know what to do. If you don't know what to do, you're going to rush him to the hospital. So this is the reason why we are here to tell you what you need to do in these 3 crucial minutes. But when I say somebody collapses in front of you, every collapse is not a cardiac arrest. There are so many other reasons of collapse. The person has not had breakfast in the morning, his sugar level drops, hypoglycemia, person collapses. Overdose of medication could be a reason of collapse. Fits, mirgi, that could be another reason of collapse. Or even a drunken person collapses. So many different reasons of collapse. So the first thing we are going to teach you today is how to recognize a cardiac arrest. Secondly, we are going to teach you how to do CPR or cardiac massage. And the third thing we're going to teach you today is how to use this machine. This is called an AED. The full form is automated external defibrillator. In lay language, it's called a shock machine because this machine gives a shock to the stopped heart so that it starts pumping again. But this is not for doctor use, it is for your use. You must have seen in movies, the doctor takes the person to the operation theater, gives a shock like this, and he says, okay, he's gone, he's theek ho gaya ye. This machine does the same work, but in the hospital, it is a big machine. This is a small portable machine. With our project, we're putting it in different places, starting from Bandra. You would have seen a lot of these machines at the airports. Big malls have this machine. So how to use this machine also we're going to teach you. So we're going to go through some slides. We're going to show you a video, and we're going to teach you this whole thing in totally non-technical language. And whatever questions you have, please keep putting them in the chat box. We're going to take all questions, but at the end of the session. So I'll request Anand to start off with the presentation.
Thank you, Sumaya. Good morning, everybody. My name is Anand. हमें बहुत अच्छा लग रहा है कि आज आप हमारे साथ हैं. It's an open session, and we take pleasure in sharing knowledge with a lot of people and whoever would like to learn. So we're very happy today. So what you're going to learn today is known as a life skill, which means information that will help you save somebody's life one day. और ये information इतनी crucial है कि अगर आपको ये समझ में आ जाता है कि किस तरह से लाइफ बचाते हैं, then you will definitely be able to help. Okay? तो चलिए शुरुआत करते हैं and शुरुआत में I'm going to tell you an observation that I have had a few times and I'm sure you've had also. And that observation is this. Let's say you're walking down the road one day. Okay, you're on a public street. You're walking down. Let's say you're going to the bank, and you happen to see a person collapse. You're going to observe that a crowd gets collected. A lot of people, they collect and they want to see what's going on. लेकिन you're also going to observe कि वहाँ पे कोई भी एक ऐसा इंसान नहीं होता जो crowd से निकल के उस इंसान की help करे और बोले कि मैं मदद करना चाहता हूँ. जो मदद करते हैं वो एक दो तीन लोग होते हैं, उससे ज्यादा लोग नहीं होते. So my direct question to you is, why does that happen? Why is that people, the people who are looking at the person who's injured and they can visually see that the person needs help and still they're reluctant to help? So we believe there are a few reasons why people don't, and we're going to tell you those. So according to us, the primary reason why people don't help is because everybody's a bit worried about the cops. So they are a little scared. And when I say cops, I mean the law. तो हमें ऐसा लगता है कि अगर कुछ उल्टा सीधा हो गया, हमने मदद की, तो ऐसा ना हो कि केस हम पर बन जाए या फिर we would have to face a lot of inconveniences. We would have to go to the police station over and over again. And so we don't really have, we just walk by, we go wherever we want to and we just leave the situation as it is, which is not the right thing to do. But I understand the hesitation. That's why I want to tell you a bit about this. So this particular problem of people not coming forward to help had become quite chronic in our country. And that's why in the year 2016, our government, and when I say government, I mean specifically the Ministry of Road Transport and Highways. So they formed certain guidelines to issue this particular problem. Now, they named those guidelines the Good Samaritan Law. So इस law के द्वारा हमारी सरकार ने हमारी पुलिस को ये एडवाइस किया है कि अगर वो कोई एक ऐसी जगह पे पहुंचते हैं जहां पे वो देखते हैं कि एक इंसान किसी दूसरे इंसान की हेल्प कर रहा है, तो उस इंसान से उसका आइडेंटिफिकेशन नहीं पूछना चाहिए. So please don't ask for the identification of the person because that is usually what the cops do. It's their job. आपका नाम क्या है, आपका एड्रेस क्या है, that's what they generally ask. So they shouldn't be asking, because if they do, the people get scared, and the next time there is actually a need where people need to help, they don't, because they become reluctant and they get scared. They get scared of the cops. And the same thing has been advised to the hospitals, where they've been told not to ask the identification of the person who's trying to bring an injured person in, and also not to ask for any admittance fee. ठीक है, तो मैंने आपको ये इसलिए बताया क्योंकि अगली बार वाकई में किसी की मदद करने का मौका मिला तो आप प्लीज हेजिटेट ना करें और उसकी मदद करें. द कॉप्स आर विद यू, द पुलिस इज विद यू, द लॉ इज विद यू, द कंट्री इज विद यू. ठीक है. The second reason why people don't help each other is because they don't know what to do. Now, if you don't know what to do, how are you going to help? And specifically when it comes to sudden cardiac arrest, you wouldn't know what to do. So we're going to tell you more about it. And the third reason is COVID-19. Now, this session is not about COVID-19. That's why we're not going to go into details about it. But I just want to tell you one or two odd things about it. Remember, any single moment of time when you want to help a person on the street who's a stranger, it's absolutely important before helping you follow all the COVID-19 protocols. Meaning, you need to have the mask on your face. Be sure to have a mask on your face. And if the person you're trying to help doesn't have a mask on his face, and you have a handkerchief, maybe, let's say a dupatta, maybe, put it over that person's mouth, cover his mouth, and then help that person. Okay, this virus is deadly. Nobody needs to contract it. Okay. All right, Wilma, can we have the next slide? Okay, if you see this slide, you should be able to see a person in a sitting position and the same scenario rolled out, the one that I just told you about, where a crowd is collected and people are just looking at him, but not really doing anything. And if you can observe, they just, they have a distance between them and the person and nobody is really coming forward to ask whether he's okay. Now, generally, what happens is somebody, you know, in the crowd, they call the ambulance. Somebody calls the cops. So now let's put you in the situation of one of the people in the crowd. So let's say you call the ambulance. So what are you going to do after you call the ambulance? I'm assuming nothing. Basically, because you don't know what to do. That's kind of excuse, right? We understand that part. Now, I want you to know one thing over here. Vilma, can we go back to the slide? Okay, thanks. So now I want you to know one thing over here. और वो ये है कि if the person has collapsed because of sudden cardiac arrest, and even though you may have called the ambulance, it's so important you help that person, because ideally we don't. What we do is we just stand there, we just observe the person, and we are waiting for the ambulance to arrive. Quite, we're thinking that the ambulance is going to come, and whatever is going to happen, the ambulance is going to do. Okay, in normal situations, that is what happens. But remember this, if the person is collapsed due to sudden cardiac arrest, you would need to help. Why am I saying this? Because this person will not have time. He's going to have only 3 minutes of time to himself. Now, within 3 minutes of time, his brain is going to get damaged. He might go into coma. And in about 10 minutes of time, he's going to no more. He's going to be no more. Now, you know for a fact that, there are times when the ambulance does take time to arrive because of certain reasons. Let's say the traffic conditions are too much and the ambulance is trying to arrive on time or as soon as possible, but it's not able to. And let's say it arrives after 10 minutes or 15 minutes. But by the time 3-4 minutes have already gone by and this person's brain is already damaged and he's gone into coma. And in 10 minutes, he's no more. So nobody wants that situation to occur. That's the reason you need to help till the time you know that the ambulance is on the way. Okay? Remember one thing, every single minute you delay initiating help, the person is dying by 10%. So if you keep waiting for 10 minutes thinking, oh my God, police ka problem, ye problem, the person is going to be no more. Okay? Keep this in mind. Okay, Vilma, next. Vilma, next. The other way around. Yes. Okay. So if you see this slide, you should be able to see three people here. And I'm sure you must have recognized these people also. So this Christian Eriksen, this Rima Laguji, and Dr. Kalam sir. Now, for the people who follow football, you would have recognized Christian Eriksen. He's a Denmark citizen and he's a professional footballer. Rima Laguji, of course, you must have seen her on television and in the movies. And Dr. Kalam sir, of course, our former president of the country, right? Now, all the three suffered sudden cardiac arrest. But unfortunately, Rima Laguji and Dr. Kalam Saab, they are not with us today. They did not make it. The only lucky person amongst the three is Christian Eriksen. He got a sudden cardiac arrest last year. He was playing he was on the field actually playing, and he got sudden cardiac arrest. But fortunately, they were healthcare workers and they revived him. Now, I have a point to tell you by showing you the faces of these three people. Now, before I tell you the point, I want you to notice the ages of these people. So look at Christian Eriksen, he's a bit young. Rima Laguji is a bit elder to him, and Kalam Saab, of course, is the eldest, right? Now, my point is, sudden cardiac arrest is one thing that does not make any distinction when it comes to age. So it can happen to just about anybody, any age. And if you think, maybe it can happen only to people who've crossed, let's say, 70, 80, 90, that's just not true. Because it can happen to children also. So ये बच्चों तक को हो सकता है. So the point being, every single person needs to know how to help. Okay? And it's not just regardless age, by the way, it's also regardless fitness levels, and it's regardless gender, which means it can happen to a person who's absolutely fit of health. He's got a great diet. He goes to the jog every day. He goes to the gym every day. It can happen to him, and it can happen to a man, a woman, or a third gender. Okay? All right. Vilma, next. Okay, now this is a very important slide, guys. Please pay attention to this. ये differentiation है between heart attack and cardiac arrest. Now, generally लोगों को नहीं पता होता है कि heart attack और cardiac arrest ये दो अलग-अलग चीजें होती हैं. So मैं already told you कि दो अलग-अलग चीजें होती हैं. Generally हमको ये लगता है, if there is a problem, somebody had a problem with the heart and he's been taken to the hospital, तो हमको लगता है heart attack का ही problem होगा, which may not be true. Okay, so we want you to know the difference. Also, the reason why we want you to know the difference is because the way to help each is different. तो ऐसा नहीं होना चाहिए कि हो रहा है कुछ, आप मदद कर रहे हैं किसी और तरीके से, right? So let me begin by heart attack. So what exactly is our heart? Our heart is a muscle. Okay, it's a muscled organ basically. So you have a lot of muscles in your body. Your heart is one of them, right? Now the primary function of the heart is to supply blood all over the body, right? You know this. Now what we generally forget is that it supplies blood to itself also, right? Now it supplies blood how? Via arteries. Now these arteries are going everywhere in the body and the blood is being supplied. Now the problem that we're talking about occurs in these arteries, and the name of the problem is blockages. I'm sure you must have heard this term as well. But what is the problem that blockages cause? The problem that the blockages cause is that they stop the supply of blood. So the bigger the blockage, the more the supply of blood is stopped. Okay, and if the person does not take any medication, the problem is that the blockage, it keeps getting bigger over time. And at a certain point of time, it grows so big that it's covering the entire artery, which is known as 100% blockage, which means no blood is now passing anywhere in the body. And because the artery is blocked, it's not going anywhere in the body, it's not going anywhere in the heart either. Because of which the muscles and the tissues of the heart, they get damaged. And at a certain point of time, they die. And this is known as heart attack. Okay? If you did not understand this, that's quite okay. Let me tell you इसके symptoms, ताकि आपको ये पता चले कि एक इंसान को क्या हो रहा है. Okay? So you recognize heart attack. So let's assume आप सड़क पे चल रहे हैं और आपके सामने कोई एक इंसान है जिनको ये हो रहा है. तो आप क्या देखोगे उसके अंदर? What are you going to observe? You're going to observe the first thing, he's going to complain of chest pain. Okay, massive chest pain in the middle of the chest. You're going to observe he would have perspiration all over his face, which is known as cold sweat basically, right? You're going to observe that he may have back pain, he'll complain of back pain or left shoulder pain, or maybe jaw clamping maybe, right? And you're going to observe that he's become very weak suddenly. If he was walking earlier, he will not be able to anymore, or wahin pe baith jayega. And you'll observe that he will have a very difficult time breathing. So सांस लेने में बहुत ज़्यादा तकलीफ हो रही हो. So these are the symptoms of heart attack. So if you ever happen to come across a situation like this where you're looking at a person with exactly these symptoms, it's very, very important you rush that person to the hospital immediately. Do not wait. Generally, people don't rush such a person to the hospital, quite innocently so, because they don't really even understand that these are the symptoms of heart attack. उनको लगता है कि शायद ये गैस प्रॉब्लम है, indigestion problem is, so the thing maybe, कल रात को पानी पूरी ज्यादा खाली होगी इंसान ने, and then that's the reason he's having this gas problem right now. So what you advise is usually, okay, मैं आपको पानी ला के देता हूँ, I'm going to put some into the water and you're going to be all right, just 5 minutes के लिए बैठो आप. We say this, but you should not be taking that kind of risk. Okay, you see these symptoms, immediately rush that person to the hospital. You might just save his life. Let me come to cardiac arrest. देखिए, cardiac arrest is totally different to heart attack, even in terms of how it happens. तो blocked arteries etc. उससे कुछ भी लेना देना नहीं होता है. तो क्या होता है समझ लेते हैं. देखिए, हर एक इंसान का हर एक अडल्ट का जो दिल है वो बीट करता है एक certain rhythm से. Okay, so your heart, my heart, it's beating with a certain rhythm. What is the rhythm? The rhythm is 60 beats per minute to 100 beats per minute. So 60 और 100 के बीच में our heart, it oscillates. Okay, now let's say this person meets with an accident. Let's say this person gets electrocuted, or maybe this person is drowned and somebody's got him out of the water after a long time. So what happens is, ये जो heart का जो rhythm मैंने आपको बताया, it goes completely chaotic. Okay, it like completely haywire. So while the heart should have been beating like this, beep, 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 this is how we indicate the heartbeat, right? So beep, 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 beep. After this, the heart goes like this. Right? Literally, it goes like this. Now, This means that the heart, now this is known as fibrillation. So the heart is fibrillating, it doesn't know what to do, and therefore it stops, right? And this is known as cardiac arrest, right? Now, cardiac arrest happens absolutely suddenly, अचानक हो जाता है, इसीलिए इसको बोला जाता है sudden cardiac arrest. हार्ट अटैक को सडन हार्ट अटैक नहीं बोला जाता है, क्यों? क्योंकि हार्ट अटैक के अर्ली वार्निंग साइंस होते हैं, लेकिन कार्डियक अरेस्ट के अर्ली वार्निंग साइंस नहीं होते. ओके, दैट्स व्हाई, और ये अचानक होता है, दैट्स व्हाई इट्स कॉल्ड सडन कार्डियक अरेस्ट. ओके, सो नाउ लेट मी टेल यू कि अगर आपने किसी इंसान को देखा जिनको कार्डियक अरेस्ट हुआ है, तो आप कैसे पहचानोगे? सो लेट मी टेल यू व्हाट यू गोना ऑब्जर्व इन दैट पर्सन. सो वी गोना टेक द सेम एग्जांपल. लेट्स सी यू वॉकिंग डाउन द रोड एंड देन देयर इज दिस पर्सन राइट इन फ्रंट ऑफ यू. तो उसको मान लीजिए कार्डियक अरेस्ट हुआ, तो आप क्या देखोगे? सो द फर्स्ट थिंग यू गोइंग टू ऑब्जर्व इज दैट द पर्सन इज इमीडिएटली गोइंग टू कोलैप्स ऑन द ग्राउंड. अचानक बेहोश हो जाएगा और जमीन पे गिर जाएगा. ही इज गोइंग टू बिकम अनकॉन्शियस, राइट? अब आपके ही सामने गिरा है, so quite obviously you're going to be a bit concerned. You would want to know, you would want to get some kind of response out of him. You would want to know what happened to the person. तो आप क्या बोलोगे? Hello sir, are you okay? You're going to tap his shoulder. Hello sir, hello, or like this. Hello. If you do this, you're going to realize that the person is not responding, right? You're not going to get any response out of that person. क्योंकि unconscious है, response कैसे करेगा? Then you might want to check the breathing of that person. How to check the breathing of the person? Like this. So you're going to put your finger under the person's nose and you're going to try to feel whether the person is breathing. If you do that, you're going to realize that the person is not breathing. You're not going to feel any breath on your finger. Then you might want to check the pulse of that person. आप बोलोगे मैं pulse check कर लेता हूँ. So you might want to do this, or you're going to try to do this. If you do this, you're going to realize there is no pulse either. And that time, trust me, आप panic हो जाने वाले हो. You're going to panic because you're seeing the scenario right in front of you. आदमी गिरा हुआ है, unconscious है, responsive नहीं है, breathing नहीं है और pulse भी नहीं. तो इसका मतलब क्या हुआ? What is going to be your logical conclusion that time? You're going to conclude that the person is now dead. That is what you're going to assume, right? Now, let me tell you this very clearly. If you ever happen to come across a situation exactly like I told you, no response, unconscious, no breathing, no pulse, please do not make the mistake of thinking that the person is dead, because that is not going to be true. The fact is going to be that the person has now gone into a cardiac arrest situation. And the second fact is going to be that that person needs your help immediately. उसको आपकी मदद absolutely immediately चाहिए होगी. देखिए, एक हार्ट अटैक में आदमी फिर भी बोल सकता है, इज ब्रीदिंग, तो वो आपको कंप्लेन करेगा, आई एम हैविंग सम ट्रबल, प्लीज टेक मी टू द हॉस्पिटल. लेकिन कार्डियक अरेस्ट में तो ये बोल भी नहीं सकता, वो बेहोश होगा. दैट टाइम यू आर द वन हु नीड्स टू रिकॉग्नाइज इट एंड यू नीड टू इनिशिएट हेल्प. लेकिन आप हेल्प कैसे करोगे? वी स्टिल हैवंट टोल्ड यू, सो वी गोना कम टू दैट. बट बिफोर वी कम टू दैट, आई वांट टू से वन मोर थिंग बिफोर वी कंटिन्यू. देखिए, a few slides back I had told you that you need to help that person before 3 minutes have occurred, even though you may have called the ambulance. I hope you remember this, right? अब देखिए, मैंने आपको ऐसा क्यों कहा था कि 3 मिनट के अंदर अंदर हेल्प करना है? उसका एक लॉजिकल रीजन, एक्सप्लेनेशन मैं आपको दे देता हूँ. देखिए, हमारे बॉडी में एक बहुत ही सेंसिटिव ऑर्गन होता है जिसको ब्रेन कहते हैं, दिमाग. Now, for the brain to function fully, it requires a continuous supply of blood and oxygen. Okay, so and the blood and oxygen are passed to the brain by the heart, right? Now, the oxygen, by the way, goes with the blood. That's why it's known as oxygenated blood. Okay. अब अगर एक इंसान को कार्डियक अरेस्ट हो जाता है, इसका मतलब हार्ट बंद हो गया है, हार्ट के सारे फंक्शंस बंद हो चुके हैं, तो ब्लड कहीं पास नहीं हो रहा है. और अगर ब्रेन को 3 मिनट तक कंटिन्यूअस ब्लड सप्लाई नहीं मिलेगी, तो ब्रेन डैमेज कंडीशन में जाएगा. Okay, a few more seconds, the person is going to go into coma. 10 minutes, the person is not going to be anymore. And that's the reason it's very important कि उस समय you have to initiate help immediately. Don't think too much. Immediately jump into action and help. How are you going to help? So now we're going to tell you. So मैंने अब तक आपको ये बता दिया कि प्रॉब्लम क्या है. अब हम आपको बताते हैं कि सोल्यूशन क्या है. आप क्या कर सकते हैं उस इंसान का ना ही सिर्फ ब्रेन बचाने के लिए, लेकिन उसकी जान बचाने के लिए भी. So we're going to tell you in 4 very simple steps Keep writing down whatever you want to, and at the end of the session, you can ask us a lot of questions. Okay. All right. So, ma'am, could you please take over?
So now we have understood that a heart attack and cardiac arrest are two different things. In a heart attack, a person is telling you he's not feeling well, he's getting chest pain, you're rushing him to the hospital. While in a cardiac arrest, the person has collapsed in front of you, he's not breathing, he's not responding. And how to help this person is what we're going to learn in the next 4 easy steps. So coming to our first step, the first step, we need to recognize that the person who's collapsed in front of you has collapsed due to a cardiac arrest or due to some other reason. So how do we do that? So assume somebody collapses in front of you. The first thing you're going to do is put this person on the floor, directly on the floor, make him lie down straight. Once you put the person on the floor, you have to tap both his shoulders hard and ask, are you okay? You're checking whether he's responsive. So you'll do like this. Hello, are you okay? Are you okay? So you can see Anand and me like this. We're tapping both shoulders. Hello, are you okay? Hello, bhai sahab. No answer. That means you know this person is unconscious. Now you have to check whether he is breathing. So there are so many different ways of checking if a person is breathing. You can put the finger under the nose. You can check the heart. You can check the pulse. All these ways are not wrong. They are correct. But we're going to teach you the fastest way of checking if somebody is breathing. And that is by putting your hand on the abdomen. So the person is lying down. You'll keep the hand here on the abdomen, press it for 10 seconds and check if there is a movement. So if you can see Anand and you can see me, I request all of you all to also do this with us so that you have an idea. Just sit up straight, keep your hand here, press it for 10 seconds, take a deep breath, then breathe out, breathe in and breathe out. You will feel a movement over here that shows that the person is breathing. So the similar way, you will keep the hand here on the person who's collapsed for 10 seconds and check if this person is breathing. Now, if you feel the movement, if you feel the person is breathing, that means he has collapsed due to some other reason, rush him to the hospital. But if there's no response and there's no breathing, that means you have identified he has collapsed due to a sudden cardiac arrest. So our first step, no response, no breathing, you have identified a sudden cardiac arrest. But don't think he's not responding, he's not breathing, that means this person is gone. No, he's in a cardiac arrest. He has 10-15 minutes of time and you have to help him. So I'm going to repeat this in Hindi. होश नहीं है, सांसें भी बंद है, हमने cardiac arrest पहचान लिया. In English, no response, no breathing, we have identified a sudden cardiac arrest. This is our first step. Right? Vilma, can we have the slide, please? So if you can see here on the slide, person is made to lie down, tapping his shoulders, no response. Check for breathing, no response, and no breathing. You have identified a sudden cardiac arrest. Now we're going to step number 2. Step number 2, you're going to call for medical help. Remember, you're not a doctor, and even if you're a doctor, this collapse has happened outside the hospital. If somebody collapses in the hospital, you have a lot of people to help him. But this person has collapsed either on the road or in somebody's house or on the railway station out of hospital. So you do need medical help. So make sure today only you save in your phone emergency numbers, that is hospital numbers around you, wherever you are staying and wherever you're working, around you, whatever hospitals are there, make sure you save the numbers in your phone today. Also, there's a number called 108. This number is a government service number which you can dial directly from your phone. So make sure you save hospital numbers and 108 both in your phone, because remember, emergency can happen anywhere, anytime. So kahi bhi ho sakta hai emergency. So make sure you save emergency numbers in your phone today. Now, when you call for an ambulance, remember at that point of time, it's a very panic situation. Somebody has collapsed, a lot of chaos, confusion, noise. You may call the ambulance and say, please send me an ambulance quickly. At that point of time, a ward boy will come in a small ambulance with a stretcher. But in this situation, whenever you call for an ambulance, you need to specify, please send me a cardiac ambulance, because every cardiac ambulance has a doctor as well as this machine. So make sure in your second step, when you call for an ambulance, you ask for a cardiac ambulance. And also, if this machine is somewhere around you, make sure you ask somebody to go and get the close by machine, AED machine, because as I told you in the beginning of the session, we have placed this machine in various places here in Mumbai. There are a lot at the airports, big malls also have this machine. So in case you know this machine is somewhere around you, ask somebody to get the close by AED machine. So second step, you're going to call for a cardiac ambulance and for the AED machine if you know it's somewhere around. Yes, Anand.
I just like to say about the number 108. देखिए, 108 number is a government service number, but we're not just talking about Maharashtra. Okay, I just want you guys to know that 108 is prevalent in 18 states of the country. तो ऐसा नहीं है कि सिर्फ महाराष्ट्र की बात है। अगर आप मान लीजिए कोई रीजन से बाहर हैं, आउट ऑफ स्टेट हैं, और आपके सामने ये हादसा होता है and you're not really sure whether 108 is working there, you can quickly Google and check whether 108 is available or operational in that state. And if it is, quickly you can call that number and get help as soon as possible. Okay. All right. So, ma'am.
So we have done our 2 steps. We have recognized a cardiac arrest and we've called for a cardiac ambulance. Now we are going to our third step where we are going to learn how to do CPR. So first of all, let me show you where exactly you need to do CPR or cardiac massage. So if you can see the mannequin, think of an imaginary cross. The point between the two nipples, the center point here, this is the point where you will be doing chest compressions or CPR. So if you feel your body from the top, there's a hard sternum and then there's a soft portion going in here. So exactly the point between the two nipples is where we'll be doing chest compressions. Now remember, this point is the same if it is a man or a woman, the point remains the same, right? Now we're going to show you hand position. So again, I request all of you, although we cannot see all, but please do this with us so that you have an idea how the hand position needs to be done. So put your dominant hand straight. That is, if you're a righty, you put your right hand. If you're a lefty, you put your left hand. Make sure your hand is completely stretched out, elbow straight. Open up the fingers and interlock it from the top with the other hand. Make sure both hands are completely stretched out. Both elbows are straight. This is your position to do CPR. If you can see Anand and myself, this is your position, right? This is the heel of the palm. This heel of the palm will come in this center point, the center point between the two nipples, like this. And how to do CPR, just going to show you a small video with which you'll understand this even more. So let's watch this video.
Your turn to practice.
So as you can see on the screen, the person is made to lie down, heel of the palm, center of the chest. He's taken his position, his hands are interlocked just like the way we showed you. And he's going to start doing CPR or cardiac massage. So remember, this needs to be done either on the left-hand side or the right-hand side of the person, not from the head side and not from the leg side. So he's taken his position, hands are interlocked, elbows are straight. Now let's watch how he does CPR, and then we're going to learn more about this after this video.
First, get into position. Place the heel of one hand on the center of the chest. Put the heel of your other hand on top of the first. Follow along with the drum beat. Let's begin. Push straight down, hard. Push down at least 2 inches. Push at the rate of 100 to 120 compressions per minute. After each compression, let the chest come back up to its normal position. Keep your compressions going until the drum beat stops.
So can you see how he's doing the compressions? Elbow straight, full pressure coming from the shoulders. He's compressing down, allowing the chest to rise, compressing it again, hard and fast. He's not stopping. He's doing this continuously. Remember, you need to do it this way in case of an emergency. So just like how we saw in the video, heel of the palm, center of the chest, and he started doing the compressions. Now these compressions need to be done at the rate of 100 to 120 beats per minute, going down 5 centimeters and recoiling, doing this continuously. So why this beat 100 to 120 beats per minute going down 5 centimeters? Because our heart pumps like this, 1, 2, 3, 4. With the same rhythm, you have to do the compressions, 1, 2, 3, 4. So exactly what are we doing? His heart has stopped. And because the heart has stopped, blood is not reaching the different parts of the body and the brain. And if the blood doesn't reach the brain, in 3 minutes, the brain goes into a damaged condition. 10 minutes, the person is gone. We do not want this to happen. So the heel of the palm becomes his heart. The moment you keep the hand in the center of the chest, you compress down and you recoil. That is, you allow the chest to rise. Blood from his heart is pushed to his brain, keeping his brain alive. See how important this is. Every time you compress and recoil, blood is reaching his brain. But it is not easy to do this. Remember, you're on your knees, you're giving the full pressure from your shoulders. After some compressions, you will be tired out, however fit you are. But compressions need to be done. So what do we do in a situation like this? So one thing is good. When somebody collapses in our country, they have 10, 15 people stand around you giving you free advice. You know, we hear this juta sungao, pani pilao, give him water, put a juta. We say no. We have learned CPR and you start doing this compression. Tell everybody around you, watch how I'm doing. The moment you feel slightly tired, you tell the person in front of you, now you take a turn and do this. Then you take a turn and do this. Let people do this turn by turn so that effective compressions are done. While the other person is doing the compression, you can check whether he's doing it correctly. You can call the ambulance and you can take some rest also. So turn by turn, let people do the compressions. But till when? Till when do we have to continue doing compressions? So you have to continue doing the compressions till one, he revives. That is, he opens his eyes, he starts breathing. You stop your compressions. Secondly, your cardiac ambulance arrives. Then you will pass him on to the doctor to take care of him and you will stop your compressions. Or thirdly, if somebody brings this machine and gives it to you, then to attach the pads of this machine, you will stop the compression. Otherwise, you're going to continue doing compressions. Doctors have done this compression even for an hour and a half and save somebody. So you're not going to decide, oh, 10 minutes we've done compression, it's no use, let's stop. You have to continue doing it however long it takes. The ambulance may take half an hour, 45 minutes to come. Till then, you have to continue doing compressions. So center of the chest, you're going to continue doing chest compressions at the rate of 100 to 120 beats per minute, going down 5 centimeters and recoiling, doing this turn by turn till he revives or till your cardiac ambulance comes. Yes, sir.
देखिए, इससे पहले कि मैं आगे बढ़ूं, अगर आपके पास क्वेश्चंस हैं, आपके दिमाग में क्वेश्चंस आ रहे हैं, तो प्लीज चैट बॉक्स में डालते जाइए, ठीक है? Okay, and I hope you guys have a pen and a paper so that you're writing everything down. It's very important. अगर जो भी इस सेशन के दौरान आपको important लगता है, प्लीज लिखते जाइएगा, because you may not remember it like after 6 months, but if you've written it down, तो आपको एक refresher होता रहेगा, ठीक है? So I am assuming there would be a few people in the audience who would have seen this demo of CPR being done for the very first time in their lives, right? If you've seen this for the very first time, I'm telling you this, it's very different from seeing it in the computer and experiencing it if it happens in real life. तो एक कंप्यूटर में देखना अलग है, एक असल लाइफ में होना एक अलग बात है. अब देखिए, उस समय जब हादसा होता है, आपको हेल्प करना ही है, करेक्ट है? Now, we don't really want this session to be just another session. We want this session to be really helpful. तो उस समय आपको hesitate नहीं करना है. So imagine this scenario. You're on the street. A person who's a cardiac arrest victim is lying right on the street in front of you. There are like 100 people watching what's going on and you know CPR has to be done on that person. उस समय आपको hesitate नहीं करना है. और आप hesitate ना करो, इसीलिए मैं आपको दो बहुत strong reasons बताना चाहता हूँ. Okay, so strong reason number 1. At that point of time, आपको उसको पानी नहीं पिलाना है, आप उसको पानी नहीं पिला सकते उस इंसान को. ओके. सेकेंड, आप उसको कोई फूड आइटम मुंह में नहीं रख सकते थिंकिंग कि अगर इसको मैं कुछ दूंगा खाने को या दूंगी खाने को, then this person might become all right. You can't do that. The third, you can't give any medicine to that person at that point of time. And the last thing is, you're not a doctor, so how will you won't be able to inject any medicine into that person. And even if you happen to be a doctor, you may not have your tools at that particular point of time. तो आपके पास उस समय चारा क्या बचता है, क्या ऑप्शन बचता है उसकी जान बचाने का, और वो ऑप्शन एक ही है, उसको बोलते हैं CPR. So you have to perform CPR on that person no matter what happens, okay, if you want to save that person's life. Okay. Strong reason number 2, CPR करना difficult है ही नहीं. It's not difficult to perform CPR. Okay, you have to do it exactly how you saw it in the video. और आपको सिर्फ शुरुआत करनी है. आप शुरुआत करेंगे तो आपसे हो जाएगा. This is like a guarantee. So I'm guaranteeing this to you. You just begin it and it's going to happen. Okay, just remember one thing, it has to be 100 to 120 times per minute, which means you have to continue, keep on doing it, and you have to keep a count. So 1, 2, 3, 4, 5, like this. And you have to go 5 centimeters deep. You do this and you will potentially save the life of that person. Okay. तो मैं आपको दो तीन चीजें और बता देता हूँ सीपीआर के बारे में. CPR is cardiopulmonary resuscitation. Cardio means cardiovascular, it's about your heart, right? Pulmonary means something to do with the lungs or the lungs. Resuscitation means revival. So you're trying to revive a person, that's why it's called CPR. Okay. The other thing is, every single time we've seen CPR being done on television or in the movies, or we've read it somewhere, we've always observed one thing. Along with CPR, there's always this ritual of giving mouth-to-mouth resuscitation. You know, you have to give oxygen from the mouth, is what people say. This is what you have to do. Unless and until you do that, CPR is not complete, is what people say. Now, I want to make this thing clear. I want you to know this very clearly, that there is no requirement for you to do mouth to mouth. You don't have to do it. करने की कोई जरूरत नहीं है, मत करिएगा. Under normal circumstances, if you've seen the person collapse right in front of you, and there is no water body involved, नॉर्मल सिचुएशन है, वहां पे आप सीपीआर के साथ सीपीआर ही करो. माउथ टू माउथ करने की कोई जरूरत नहीं है. अगर आप माउथ टू माउथ करते हो तो वो इन अ वे मिस यूज ऑफ टाइम कहलाएगा. ओके, हैविंग सेड दिस, आई वांट यू टू नो कि ऐसा नहीं है कि माउथ टू माउथ किया नहीं जाता है, वो किया जाता है, बट अंडर डिफरेंट सर्कमस्टेंसेस. फॉर एग्जांपल, इफ वाटर बॉडी इज इन्वॉल्व, the person is drowned for a long time, you got him out of the water, or maybe it's the person is asthmatic, or maybe it's a drug overdose situation. That is when you have to do it. Otherwise, in normal circumstances, avoid. Okay. Now, the last thing that I want to say is, I just want you to write it down if you've got a pen and a paper. If you don't, you just remember this. This is very important. Okay. And I'm not going to explain this. I'll just tell you the line. And the line is this: CPR is not performed on a person who is breathing. Okay, I'll repeat this. If you are going to write this down, I'm going to repeat this. CPR is not done on a person who is breathing. In Hindi, CPR उन पर नहीं करते हैं जो सांस ले रहे होते हैं. तो कोई भी रीजन से आदमी कोलैप्स होता है, उस पर आप CPR नहीं करोगे, इंक्लूडिंग अ हार्ट अटैक विक्टिम. Okay, why not? Because a heart attack victim is breathing or will be breathing. There is no requirement for you to do anything or CPR on that person. All you have to do is rush that person to the hospital. And the no breathing problem occurs only in one situation, which is known as sudden cardiac arrest, जिस पे आप CPR immediately करोगे. Okay? All right.
So we have completed our 3 steps. We have recognized a cardiac arrest. We've called for a cardiac ambulance, and we've learned hands-only CPR in the center of the chest at the rate of 100 to 120 beats per minute, going down 5 centimeters and recoiling. Just like Anand told you, you do not need to give mouth-to-mouth resuscitation. Earlier, we have heard about 30 compressions and 2 breaths, but right now, it's not necessary to do mouth-to-mouth resuscitation unless you're trained, especially if the person is unknown to you. If somebody's collapsed on the road, please do not give mouth-to-mouth resuscitation, because you never know what kind of diseases you may also get. So we've completed our 3 steps. Now we're going to our 4th step, where we're going to learn how to use the AED machine. So this is the AED. The full form is Automated External Defibrillator. In lay language, is called a shock machine. And in case you've seen this machine in any other shape or color, please do not worry. There are different manufacturers, different shapes and color, but they all work the same way. So this machine looks like this from inside. If you can see, there is a pull lever. The moment you pull open the lever, it's going to tell you what to do step by step. So I'm going to do that.
Begin by removing all.
Now I'm switching off this machine to explain to you, but in case you ever use this machine, you will keep it on at all times. So the moment you open the machine, if you can see, there's a set of sticky pads. There are 2 pads. Each pad has got a picture with an arrow indication where this needs to be attached to the body. So this one says here on the right hand side below the collarbone, and this one says here on the left hand side below the ribs. So just like how the picture is given, I'm going to peel these pads and attach it on the mannequin and show it to you. So I'm peeling it off, I'm attaching it. Now I've attached the pads just as the picture given. Remember, you also need to attach the pads as per the picture given. because our heart is a little bit over here. So when the shock is delivered, the shock needs to go through the heart. If you put the pads like this or any other way, the shock is not going to go through the heart. That is why the picture is given, and we need to follow that and attach the pads. Now, these pads need to be attached on dry and bare skin. That means सूखे हुए skin पे and dry skin you have to put it, because if the person is taken out from a water body, it's raining a lot or he's perspiring a lot, you need to wipe that portion and attach the pad so that they stick properly. Now, secondly, these pads need to be attached over bare skin. Bare skin, why? Because if you put them on clothing, they're not going to give a shock. These are electrodes. So there's a little problem in that. If somebody collapses in the public place, there's so many people around that. If it's a gent, it's very easy. You just pull up the shirt, open the buttons and attach the pads. But the same thing can happen to a lady. And if it's a lady, it's a public place, what will the people around you say? What are you doing? Why are you removing the clothes of the lady? Modesty comes in the way. So we have a small solution for that. If the lady is wearing a sari, you can adjust the blouse and attach the pads. But if the lady is wearing a full suit, then in this box, if you can see, there is a pair of scissors. All that you need to do is take out that pair of scissors, cut this portion of the clothing, cut this portion of the clothing and attach the pads. You do not need to remove the whole clothing. So modesty will also be there and you will save the life also of the person. So we've attached the pads. Now let's listen to what the machine is saying.
Place pad. No one should touch the patient. Analyzing.
It's analyzing the heart rhythm of the person who's collapsed.
No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now.
See, it's saying
Deliver shock now.
it's saying to press the flashing button to deliver shock.
Press the flashing orange button now.
So I'm going to press that.
Deliver shock now. Shock delivered. Be sure the ambulance service has been called. It is safe to touch the patient. Start CPR.
So what did the machine do? The moment you attach the pads, first of all, it analyzed the heart. Once it analyzed the heart, the machine decided whether the shock is required or not. You're not going to decide that. If the machine feels the shock is not required, the machine will say shock not required. But if the machine feels that the shock is required, there was a button that was flashing. You must have seen the button. All that you need to do is press that button. When you press that button, the person will get a bit of a jhatka. He'll get a shock. At that point of time, you do not have to touch him because he's getting a shock. If you touch him, you will also get a shock. There he's lying down, here you will be lying down. 1 + 1 = 3. So do not touch him, only press the button. Once the jhatka happens, the machine says, now it is safe to touch the person. Start CPR. So you will not remove the pads, you will not switch off the machine. You will continue to do CPR in the center of the chest, just like how you did in step number 3. For 2 minutes, the machine allows you to do CPR. After 2 minutes, it goes into the second cycle. Second time, it will analyze the heart and decide if the second shock is required. Because not necessary in one shock, his heart may start pumping. He may require 2, 3, 5, 10 shocks. But how many shocks to be given, the machine only will decide that. All that you need to do is listen to the prompts and follow what the machine is saying. Remember, this machine is made for you to use, not for doctor use. So if you have the machine in front of you, don't be scared. Go ahead, use the machine. You can also save somebody's life. Yes, Anand.
So I'm going to say the same thing I told you about CPR, about AED. Okay, so at any single moment of time when you have an opportunity to use this machine, please do not hesitate. But now I'm thinking about the obvious thing that might be going in your mind right now. You might be thinking, ये machine तो हमने कभी देखी नहीं है, and I don't even know where to get it. I don't know what these two guys are showing. So I understand that you're not going to get this machine in your medical store. If you want to get this machine, you would need to go to sites like Amazon.com, or you can find out the number of the manufacturer and give him a call, and he's going to come and install it. Okay. So I don't really want to tell you about this machine per se because Sumaya has already told you. I just want to make 2 requests of you. Okay. मैं 2 requests आपसे करना चाहता हूँ. पहला रिक्वेस्ट ये है कि आप ये सेशन खत्म होने के बाद प्लीज गूगल में जाइए और AED टाइप करिए और इसमें कुछ आर्टिकल्स आएंगे. उन आर्टिकल्स को प्लीज पढ़िए. द पॉइंट इज that I want you to educate yourself in understanding what this machine is all about. Okay, it's very very unfortunate कि ये machine हमें हिंदुस्तान में कहीं दिखती नहीं है ज़्यादा. और अगर आपने ये सोचा होगा कि हमने ये मशीन कभी देखा नहीं है, that may not be true also, because you must, there are a lot of machines kept at the airport. तो अगर आप एयरपोर्ट गए होंगे तो आपने वहां पे जरूर इसको देखा होगा, लेकिन रजिस्टर नहीं किया होगा, because we are worried when we are at the airport, we just want to know when our flight is. So I understand that, but the next time you go to the airport, please notice करिएगा, and if you notice तो हमको ध्यान रखिएगा. Okay, हमको ध्यान जरूर करिएगा. So it's very unfortunate कि एयरपोर्ट के अलावा बहुत कम जगह पर ये मशीन दिखती है. वही मुहिम हमने स्टार्ट की है. हम चाहते हैं कि मशीन सब जगह लगे ताकि हमारा हिंदुस्तान थोड़ा सा और सेफ हो जाए. तो मेरी रिक्वेस्ट आपसे ये है कि प्लीज आर्टिकल्स पढ़िए एंड देन प्लीज एजुकेट योरसेल्फ अंडरस्टैंडिंग व्हाट दिस मशीन इज ऑल अबाउट. वंस यू रीड द आर्टिकल्स यू आर गोइंग टू कम टू नो दैट one, this machine saves lives. It has saved so many lives already. Okay, and the second is, if you, the moment you step out of India, you're going to realize that every single person knows what this machine is. Everybody knows what CPR is. Everybody knows what the laws of the land are. And this machine is kept everywhere. When I say everywhere, I mean every residential society, gyms, clubs, schools, colleges, stadiums, everywhere. But in India, you don't see this machine. And that is a shame actually. So, इसीलिए, and in fact, you know, personally speaking, I think we should have been the leaders telling the world, look what this machine is and you should install it in your housing society. Us being the second largest populated country in the world, we should be telling them, but instead we don't know. So we need to educate ourselves. That is one. The second request that I'm making of you is, after you have understood that this machine actually saves lives, please, please, please consider buying one machine. Not for your house, but for the society where you live in. आप अपनी सोसाइटी के लिए एक ये मशीन प्लीज खरीदिए. और मैं जब कह रहा हूँ कि आप खरीदिए, I don't really mean specifically you, but you can always talk to the members of your society, your chairman, your secretary, and सब मिल के पैसा कलेक्ट करके you can buy this machine and keep one in your housing complex, your residential complex. Now, if you do that, you're going to make your society safe. It's going to be a safer place to live in. Now, let me tell you why I'm asking you to buy, or rather consider buying this and keeping it in your society. The reason is those 3 minutes. Sudden cardiac arrest में इंसान के पास सिर्फ 3 मिनट ही होते हैं. उन 3 मिनट के अंदर एक कार्डिक एम्बुलेंस का आना या एक डॉक्टर का आना बहुत बहुत डिफिकल्ट होता है. और उस समय अगर आपके पास ये मशीन है जो छोटी सी है, पोर्टेबल, इट्स अ पोर्टेबल मशीन, यू जस्ट सॉ इट, तो आप उसको इमीडिएटली उठा के रश करके वहां पे लेके जाइए जहां पे कार्डिक अरेस्ट विक्टिम है, एंड देन you know attach the pads, and this machine is potentially going to save the life of that person. So in the interest of saving lives, in the interest of making this country a better place to live in, please consider buying this machine. Okay, having said this, I just want to make one thing very clear to everybody. We wanted you to know about this machine because we need you to have knowledge of this machine, but we do not sell the machine. Okay, हम ये machine बेचते नहीं हैं. In case आपके किसी के मन में ख्याल आया होगा, oh my god, these people are trying to sell the machine, we don't do that. Okay, if you want to buy this machine, like I told you earlier, go to sites like Amazon.com or call the manufacturer. He'll come and install the machine in your society. Okay, or Sumaya?
So little more things about this machine. This works on battery, and the battery life is for 5 years. So 5 years, there's no maintenance problem, no other problem. After 5 years, you can call the manufacturer, they will change the battery and you can continue using the machine. The only thing is these pads are one-time use. So if you use them the one time, they need to be changed after every use. So there's one set of pads attached to the machine, and extra one in the box. So if you've used it, you can easily change it and keep it ready for next use. The approximate cost of this machine is about 1 lakh, but this machine is not something that you need to keep in your house. Like Anand told you, a big society, one machine, college campus, one machine. If there are machines placed at police stations, railway stations, India will be a safer place to be. And another thing I'll emphasize what Anand also said is that we do not sell these machines. If you would like to buy the machine, you can go to Google, check out the different manufacturers, and you can order the machine, or you can also get it from Amazon.com. So this was about the machine. We've completed our 4 steps. We've recognized a cardiac arrest. We've called for a cardiac ambulance. We've learned hands-only CPR, and we've learned to use the AD machine. Now we're going to show you a small video, but before that, 2-3 important points. One, scene safety is very important. Somebody collapses in the middle of the road, on the railway tracks, or there's a fire hazard, electricity point. Make sure you take the person to the side of the road to a safe place, and then only go ahead and do what you've learned today. Secondly, witness fall is important. Somebody collapses in front of you, then only you're going to go ahead and help. Or somebody says this person has just collapsed. If you know 3-4 hours have passed, there's no point in doing all these things. And third thing, if somebody collapses on the bed, make sure you put the person down on a hard surface and then only do CPR. So let's watch this video. After that, I can see a lot of good comments also in our chat box, and I can see a couple of questions. But if you have more questions, keep putting them in the chat box. We're going to answer all of them after this small video.
आपको याद है ना, हम लोग उस दिन शादी में गए थे, और आपको मेरी वो फ्रेंड याद है ना, सुनीता? कल सेम कॉस्ट्यूम ना मुझे भी अपने लिए चाहिए। अंकल, याद है आपको मैंने बोला था? अंकल, 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 प्लीज हेल्प मी, प्लीज, प्लीज हेल्प मी।
Oh my God!
चलो देखते हैं।
अंकल,
क्या हुआ?
प्लीज आप एम्बुलेंस को कॉल करेंगे?
एक मिनट मैं देखता हूँ। हेलो, क्या आप ठीक हैं? हेलो, इनको कार्डियक अरेस्ट आया हुआ है। आप जाके शॉक मशीन लेकर आइए, तब तक मैं इनको हार्ट मसाज देता हूँ।
Please notice his position, elbows straight, pressure coming from the shoulders, heel of the palm, center of the chest, and he is doing the compressions.
ये बॉक्स यहीं रख दीजिए, और जैसे मैं कर रहा हूँ हार्ट मसाज, आप वैसे ही करिए।
So there is no time waste. Till one person is doing the compression, the other person is opening the box and attaching the pads. Pads are being attached as per the picture shown. Machine has prompted a shock. Press the button, and because the heart has got a shock, it has started pumping by itself. Person has come into consciousness. He started breathing. You have saved a life. Such an important thing. Till then, your cardiac ambulance has arrived. Remember, he needs to go to the hospital for medical treatment, even if he has revived. And 3 weeks later, after complete medical treatment, he is leading a normal life. Remember, young and old, cardiac arrest can happen to anybody, anytime. And every 1 minute you think, should I help or not, his chances of survival decrease by 10%. So please go ahead, save lives. Whatever you've learned today, go ahead, teach your family, your friends, spread this knowledge among your colleagues. But when you're teaching somebody, please don't tell anybody, come on, lie down, I want to do CPR on you, because CPR is not done on a person who's breathing. That is why for a person who was getting a heart attack, he was getting chest pain, he was feeling uneasy, you rushed him to the hospital. But the person who's collapsed in front of you, he's not breathing, he's not responding, is only when you went ahead and did all what you've learned today. So understand the difference, but go ahead and save lives. One day you can also save a life. I'll also add one more thing here, that today all of you all are from different fields, various backgrounds. Some of you all may be college students, may be attached to a hospital, maybe in a corporate. Do contact us. This webinar is completely free of any charges. And if you have a larger group of above 60 people, we will have this webinar for you specifically for you. We'll schedule it at a convenient date and time. So do contact us. We will have this webinar for a larger group of people specifically for you. Help us to spread this knowledge. You could also make our country safer. So let's start with the question answers. Anand, do you have any question answers here in the chat box?
So there are a lot of questions here, and then a lot of people have written down a few comments also. Thank you
Okay.
so much, everybody. चलो हम पहले questions ले लेते हैं.
Dr. Shahid Hassan from Kashmir. We also have a critical care ambulance that is ACLS, some of the districts of Kashmir, Anantnag, Baramulla, Srinagar, Kupwara. This is free of cost. Very good. Thank you, sir. This is really good, Dr. Shahid. And Dr. Shahid has put his number here in the chat box. So those who would like to use this facility, please go ahead and do that.
Yeah. डॉक्टर शाहिद हम भी आपके साथ मिल सकते हैं. आपको अगर वाकई में वहाँ पे एक सेशन करना है कश्मीर में, तो वी वुड बी वेरी वेरी हैप्पी टू कोलैबोरेट विद यू. आप हमको कॉल करिए, हम मिलके भी वहाँ पे एक सेशन कर सकते हैं. दैट बी सो गुड फॉर अस एज वेल.
Definitely.
इन द इंटरेस्ट ऑफ सेविंग लाइफ. Okay.
Okay, many
Good
people
seeing
have asked for the recording of this. I'm
Yeah.
going to put it in the chat box. It's been recorded on YouTube, so you can go on YouTube and view this.